The Social Security and Medicare Board of Trustees today came out with their report on the status of Medicare and Social Security. First, no change in Social Security funded till 2033, so 20 years from now. Mm-hmm. Imminent danger.
Yeah, oh my, panic. Press the panic button right now.
Right, we got to fix it in the next couple of months, or we're effed. And we got to make an irrational decision on how to fix it, because it's got to be done right now. But very interestingly, the Medicare Trust Fund, which had previously been pegged to be empty or unable to make this payments in 2024, now is good till 2026. Lower health care costs are improving the financial outlook for Medicare, expanding its life for 2 additional years. That's an improvement, by the way, of 9 years since passing the Affordable Care Act.
Wow,
years.
That's actually significant.
So credit for that, and credit to lower costs and use rates, quote, in most service categories, especially skilled nursing facilities. Basically a lowering of health care costs.
Just 2 quick notes there. And when you run out of the surplus, it doesn't mean you immediately go bankrupt and Medicare has no money, or Social Security in 284 years has no money. Like, for example, the Social Security case, once they run out of the surplus that they have, they then can pay about 75% still of the benefits. So now that's not a good thing. You want them to be able to pay 100%, even if it's 36 years from now, et cetera. But it's not like they immediately go bankrupt and they have no money.
That's right.
Right. And second of all, part of the reason that Medicare was such a dire situation is based on healthcare costs. And healthcare costs were going up so rapidly that they had to assume that it would continue to increase at that speed. And the reality is you couldn't, otherwise the whole country would be bankrupt in like 6 months. It wasn't going to increase at that speed, and it hasn't. And that's why we now realize, oh, it's not as dire as we thought it was 5 years ago.
Right, and also why we needed some form of healthcare reform.
That's right.
So the Washington Post ran a headline that says, the one that's up there now, Medicare Trust Fund to last to 2026 as healthcare costs drop. That's a good headline. That's okay. Here's the headline that we just put up there. That's an AP headline. It's from the paper in Arkansas. But basically, this headline was across the country. Look it up on Google. If you looked up the Medicare story, that's what it said in literally thousands of papers, just again and again. That AP story. Trustees say Medicare exhausted in 2026. Dan Frumkin, who is a terrific journalist, has been at the Washington Post for years, then the Washington editor of the Huffington Post, tweeted this morning that headline, and he was saying, hey, AP, fix that crazy frickin' headline. Because the one thing I saw, that when Ezra Klein and the Washington Post read that story, and when Laurie Montgomery, perhaps here in the Post, who wrote the story, recognized that, no, this is a piece of good news. We've extended 2 years and 9 since the passage of the Affordable Care Act. That's a big deal. That's a real headline. But put it up one more time. But the AP headline here, again, I mean, that's exactly the headline that everybody who hates Obamacare, the Affordable Care Act, is going to want. That Medicare is exhausted in 2026. That's it. It's not exhausted in 2026. And secondly, that's progress. That's 2 years since the last report.